are a physician who has been following a 62-year-old woman for several years. She has had a huge substernal goiter for the last 6 years, and although you have recommended surgery at every visit, she has refused every time. You get a phone call from a colleague at a local hospital who tells you that your patient was in a car accident last week and is now intubated in the ICU. She has a moderate traumatic brain injury with no other major injuries and is expected to recover, but she is still unconscious. In order to be extubated, she will need to have her goiter resected. If it is not removed, she will need a permanent tracheostomy. Knowing about her consistent refusals over the years, her children say she was very clear she didn't want surgery to remove it. They are now asking the attending to extubate and provide comfort care only. Your colleague, the patient surgeon, is calling you to discuss the case. She doesn't feel right letting this patient die of her TBI and wants to transfer the patient to you for resection of the goiter. What do you do? When you take care of patients, you often may be faced with similar ethical dilemmas. While it may not be hard to recognize that there is an ethical problem, the harder part is often figuring out how to confront and resolve it. Should you go with what feels right? Should you ask a colleague for advice? Should you ignore it or pass the problem on to someone else? Some of these options may seem easier than others, but they're not likely to alleviate feelings of distress that may come with difficult conflicts in medicine. If none of these options are ideal, then what do you do once you've determined there's an ethical issue? There are a lot of misconceptions about what ethicists do and how ethical analysis is done at the bedside. When it comes to ethics, many people think it's about deciding what is right and what is wrong, based on arbitrary perspectives and emotions. What is right is what feels right in your gut. We can't reason our way through a difference in values to come up with a recommendation. All we can do is offer personal opinions. So, where is the value in that? However, relying on gut feelings is not only difficult and ineffective, it's also unnecessary. The field of medical ethics relies on systematic approaches to ethical analysis that ensure the appropriate steps are taken in a case and that all factors are considered in the recommendation. This provides a clear roadmap for clinicians and anyone else engaged in ethical analysis to work through the issues in a systematized way and reach a resolution. There are multiple approaches that can be used, each of which has different strengths and weaknesses. Choosing among these approaches often depends on your background and the way you think through things. For example, physicians may find a more clinically oriented approach helpful because they are used to a standardized way of presenting patient cases and thinking through the review of systems. Methods such as the 4-box method or clinical pragmatism are structured in this way, beginning with an evaluation of the medical facts and moving through structured categories of information, including patient preferences and concerns about quality of life. On the other hand, some philosophically trained ethicists may prefer a framework that considers the options through the lens of consequences and virtues, among other considerations, in an appeals-oriented approach. A framework known as the ethics workup is an example of this approach, which prompts the ethicist to robustly consider the possible solutions in light of all relevant factors, which are considered systematically. Regardless of which approach is used, there are fundamental steps that lead to an ethically appropriate recommendation. The first step should always be to identify the ethical issue or question. In this case, the concern was whether to let the patient die because of her previous refusal of thyroid surgery. Knowing the particular dilemma that exists is important to determine how to proceed and what kinds of questions need to be asked to learn more facts. Often, the ethical issue we first think is most prominent is actually the wrong one to focus on. I was once consulted by a colleague who asked me how a parent could be removed as a surrogate decision maker for their neonate, since the parent seemed to be making decisions that were medically inappropriate and harming their child. The child was dying despite all efforts, and the parent was insisting on continuing interventions, although the medical team explained that no interventions were medically indicated or would be helpful. As I asked questions about the interactions between the family and the care team, I learned that the attending had the same discussion with the parent every day. He said to the parent, "I am concerned about the lungs since they aren't showing as much improvement as we would like. I'm also concerned about the kidneys, which we are testing every day. The heart seems to be working better, but I'm still concerned that the brain function hasn't recovered." The parent responded by saying, "Thanks for the update. Hopefully tomorrow my baby will get better. Maybe with a little more dialysis and a little more time on the ventilator, she will get stronger." I asked if the attending had ever specifically said the child was dying, or that the interventions were not improving the patient's condition and there was no more hope for improvement, and he said he hadn't. For him, his language of concern clearly meant that the patient wasn't going to survive and that the aggressive interventions shouldn't continue. But to the parent, concern meant the team was worried, but that things could improve. The ethical issue was not that the parent was not making appropriate medical decisions, which is what the team originally thought. The question was whether the parent had sufficient information to make a treatment decision at all, since it seemed there was disconnect in communication. When seen through that lens, rather than the healthcare team continuing to be frustrated by the parent's decisions, they were able to have a clear conversation about the patient's prognosis, and faced with this corrected understanding, the parent and the care team agreed on the goals of care. The second step in the ethical analysis, after identifying the issue, is to seek pertinent information about the case, since the nature of the issue will help define the questions you need to ask. In turn, asking questions will help you better articulate and define the issue. You should ask yourself, who are the important stakeholders here? Who should I talk to in order to get information that's relevant to this issue? What is the patient's medical condition, and how does that factor into the decisions that need to be made? Does the patient have capacity, or will someone else need to make decisions for her? These questions are geared towards learning about the patient's medical condition, medical and prognostic interests, preferences, and values, and will provide important information for your ethical analysis later on. After the ethical issue has been defined and you have gathered information and perspectives from the stakeholders, the next step is to engage in ethical analysis. This is complex, and we will discuss it in more detail a little later, but in general, it requires the ethicist or clinician to consider all the factors that affect the case, including the perspectives of the parties, consequences of various courses of action, and any legal, ethical, or religious constraints that affect what recommendations may be made. This is similar to constructing a differential diagnosis and evaluating imaging and testing results to help narrow down the final diagnosis. In this manner, following the ethical analysis, the ethicist then provides recommendations for moving forward and helps facilitate their implementation as appropriate. While these steps give us an idea of the kinds of tasks that are important in addressing ethical issues, what kind of guidance do they give us about how to conduct the ethical analysis, which is the substantive aspect of ethical problem solving? This is another misconception, that ethical analysis lacks any structure. Engaging in ethical analysis is not simply about getting to the right answer. The process of getting there is just as important, much like going through a differential diagnosis. And there are structured methods available to walk through an ethical analysis in a systematic, comprehensive way. Although there are several different approaches, we will focus on the 4-box method. I do want to stress, though, that whatever method you use, your approach should be comprehensive and systematic. This way, you will not miss potentially relevant information. When you read an X-ray or an EKG, you use a systematic approach. This is the same idea. Remember, the analysis does actually affect the outcome. In the 4-box method, once you identify the ethical issue, you then gather and consider the facts in 4 different categories: medical indications, patient preferences, quality of life, and contextual features. These align closely with the 4 principles of bioethics: respect for autonomy, beneficence, or doing good for the patient, non-maleficence, or avoiding harm, and justice. Good clinical ethical analysis begins with an understanding of the medical picture. What we mean by medical indications is looking at the patient's diagnosis, prognosis, and medical history to get a solid sense of what brought the patient to this point, what medical decisions need to be made, and what the likely or possible outcome of the illness or procedure may be. Next, considering patient preferences in the context of the ethical issue has a special focus. We ask first, who is making the medical decisions? Does the patient have capacity to make decisions, Or is there a surrogate decision maker? If the patient has capacity, what are their preferences regarding medical treatment? Meaning, for example, do they want to avoid surgeries if possible? Or if the patient lacks capacity, did the patient give any written or verbal indication of their wishes? The focus here is on the patient's perspective, including how they view and value their quality of life and preferences that might relate to the current medical context. A piano player might, for example, take higher risks to make sure that both hands are preserved compared to a teacher. The third step of the 4-box method is to examine the patient's quality of life. It is important here to remember that quality of life should always be viewed through the patient's perspective, not that of the healthcare team or yours. While certainly a patient's quality of life will be impacted by a severe illness, the subjective quality of life belongs only to the patient, and only the patient, either themselves or through their surrogate, can describe how they feel about the quality of their life now and in terms of future treatment options. Here, it is helpful to ask about what the patient was like before getting sick and what activities are most important to the patient. For example, when talking to a surrogate about the possibility of withdrawing life-sustaining treatment for a patient who will never regain consciousness, learning that the patient valued gardening very highly and has told his family that he would not want to keep going if he was too sick to ever garden again, would be relevant to addressing the patient's quality of life from his perspective. The 4th box, contextual features, considers issues related to the ethical concept of justice and potential conflicts of interest, which may be conflicts for the physician, for the family, or for others involved in the patient's care that could affect ethical decision-making. Are there other constraints on care, such as financial barriers, insurance coverage, legal issues, or religious considerations that limit the options available for patients? Are there other interested parties, such as family members, who have an interest in clinical decisions and outcomes? Are there any issues regarding research or public health? This box allows you to explore competing interests through the lens of justice and fairness that may affect clinical decision-making. The 4-box approach is similar to going through a differential diagnosis and the supporting data. Once you have worked through the 4 boxes, you should weigh the information and formulate an argument and recommendations to address the ethical question. You have to consider the medical information, patient values, and external interests in the context of the decision to be made. What are the potential consequences of choosing one recommendation over the other? Are there any legal, professional, or ethical guidelines that provide explicit guidance about the ethical issue that should be followed? Are there any other considerations that are ethically compelling? To provide some context, I will walk through the case I presented at the beginning of this session in the 4-box model. Medically, we know the patient is a 68-year-old woman with a substernal goiter. She was admitted to the hospital following a motor vehicle accident and was intubated. She cannot be extubated without resection of her goiter, and if she does not have the resection, then she will need a permanent trach. She has a moderate TBI and has not regained consciousness, but with continued treatment, she is expected to recover with minimal impairment. In patient preferences, we know the patient has consistently refused resection of the goiter for 6 years. She lacks capacity, and her children are currently the identified surrogate decision makers. The children have said she was clear about her wishes regarding surgery, and because she cannot be extubated without it, and she would not want a trach, the children requested comfort care measures only. When examining quality of life, we don't have enough information at this point to know what she was like before her accident or what her baseline was. We do know that she did not think resection of the goiter would improve her quality of life, given her adamant refusal. Remember, contextual features looks at interests of other parties as well as conflicts of interest and other constraints. Here, your colleague is the one reaching out to you to perform the resection, which would amount to life-saving surgery on this patient, so there may be some feeling of obligation to support your colleague, making it harder to evaluate the situation objectively. There are also multiple children, and while the case doesn't indicate there is any conflict, there is always a potential for conflict when more than one individual is responsible for or has authority to make medical decisions. In this case, respect for autonomy tells us that a person's decisions should be honored if they have capacity to make them. This means that it may be ethically supportable to decline to resect the goiter because the patient has clearly and consistently stated her wish not to have the surgery. There are reasons to support performing the surgery, such as the fact that the goiter in the past did not threaten her airway in the way it does now, and thus the refusal happened in a different context. In this case, more information may be needed before making a final recommendation. While respect for autonomy is a strong ethical consideration in this case, especially given her clear and consistent stated preferences, it is unclear why she has been refusing, and it is possible that her rationale may impact our ethical analysis. Did she refuse because she was afraid of surgery? Were there religious or cultural reasons for her refusal? The answers to these questions may clarify our ethical obligations and allow us to make a clear recommendation and implementation plan on how to move forward. The last misconception is that ethical analysis is limited and only looks at the considerations that feel most important to the ethicist. In fact, the reason that methods of ethical analysis are structured is to ensure that any ethical analysis is comprehensive. Instead of relying on intuition, ethical approaches make sure you gather and consider all of the relevant ethical facts and considerations before reaching a recommendation. Your analysis should be clear and well supported by your ethical reasoning, which is possible whether you choose to use the 4-box or one of the other systematic models we mentioned earlier, to ensure you have evaluated all the options available to you. In terms of facing or analyzing ethical challenges, there may be times where it's helpful to seek expert advice from a clinical ethicist or an ethics committee. One example of an ethical challenge may be unresolvable disagreement between a surrogate decision maker and a healthcare team about prognosis and treatment plans. In cases like this, it may be helpful for a clinical ethicist to facilitate communication and move the case towards resolution. Another example is if a surrogate is requesting the discontinuation of aggressive therapies when the healthcare team thinks this decision is premature, or perhaps an incapacitated but highly functioning patient is adamantly refusing treatment. This last scenario would require some substantive ethical analysis in order to determine whether or not it is ethically appropriate to honor the patient's refusal. In conclusion, there are 4 general steps to guide your ethical decision-making. First, identify the issue. Second, seek additional information. Third, engage in an analysis of the ethical issues. And fourth, give a recommendation and implement a management plan. It is difficult or impossible to perform the analysis or make a thoughtful recommendation without first clearly identifying the issue and gathering information. Please remember that whatever system you, as a provider, employ, it is essential to utilize a comprehensive and systematic approach to ensure quality ethical judgments. A colleague had performed an appendectomy on a 24-year-old woman when there was unexpected post-operative bleeding. Prior to surgery, the patient said she was a Jehovah's Witness and signed a general refusal of blood products. But when there were complications after surgery, the surgeon told the patient's husband that without a blood transfusion, it was likely that she would not survive. The patient's husband, who was not a Jehovah's Witness, insisted that even though the patient signed the form, she would definitely want blood products given to her to save her life now. He said she was not allowed to accept blood herself, but if it was given to her in an emergency, she would not be in violation of her religious beliefs, and therefore it was okay to give it to her without her express consent. The surgeon knew the patient herself had refused blood products, but he was worried that her husband might be right about her true wishes. In this case, the difference between providing blood or not could mean her death. He didn't know what to do. What do you do when you have an ethical dilemma and you're not sure how to solve it? We've all had cases where we felt morally uncomfortable. Whether it's a patient making decisions we think will be harmful, or several family members wanting to weigh in with conflicting opinions on end-of-life treatment, these situations can be distressing, confusing, and can negatively affect patient care if they aren't addressed. Ethical issues are part of everyday clinical practice, but we will give you some helpful tools to use to address them. As you'll learn, Ethical problem solving is an important skill that can be integrated into patient care to prevent ethical issues from arising, resolve dilemmas that do occur, and relieve moral distress. So, what is an ethical issue? As an ethics consultant, when I introduce myself to clinicians who aren't familiar with the job of an ethicist, their first question is often, "Did I do something wrong?" This is a common response, but also a common misconception. Many believe that if there's an ethical dilemma in the care of a patient, it means someone has acted badly. In my experience in clinical practice, this is rarely the case. Ethical issues are not an automatic indication of wrongdoing. They are just challenges to patient care that can arise for many reasons, despite good medical practice by the clinicians. They may vary from a difference of opinion to structural constraints outside the control of the participants, but they all introduce uncertainty or conflict into the clinical setting. So, what is an ethical issue? How do we know? Ethical issues arise when there is uncertainty or conflict about values, and a question arises about which decisions are appropriate or which actions should be taken. If this definition sounds broad, that's because it is. So many areas of patient care involve assessment and weighing of values, and decisions that need to be made about what treatment is appropriate and who should consent for them. The general rule is that if you feel there may be an ethical dilemma, the assumption should be that there is one and that it needs to be addressed. Many ethical issues involve goals of care at the end of life, since this is a decision point in medicine that requires consideration of patient preferences, goals, and values along with medical judgment. For example, how should the clinical care team respond when the family refuses the medical recommendation of a do not attempt resuscitation order for an actively dying patient? Here, there is clearly a conflict between the authority of surrogates to make decisions on behalf of a patient and the physician's medical judgment that CPR would provide little benefit while causing significant harm to the patient. Not all ethical issues in patient care are related to end-of-life treatment. Suppose you have a patient who lacks capacity, but is strenuously objecting to a lumbar puncture that is needed to diagnose suspected meningitis. Can you sedate the patient and perform the LP? It is important to act in the patient's best interests, but forcibly sedating the patient who is actively refusing an intervention may be uncomfortable or feel like an intrusion on patient autonomy, even if the patient currently lacks the ability to understand and make treatment decisions. Another ethical question is what to do if it is discovered that a patient has HIV. Can this information be disclosed to the patient's spouse, to their parents, to their partner? Identifying ethical issues is the first step in resolving conflicts like these, but how do you confront the question and work to resolve it? There are various strategies clinicians use to work through ethical issues, such as asking for advice from colleagues, looking to institutional policies as guidance, praying, developing a pro-con list, or sometimes just relying on their gut instinct or general moral intuition. Many believe the field of bioethics relies on these strategies as well, and that the clinical ethics consultants, who are available in many hospitals to address and resolve ethical conflicts, simply recommend the outcome that feels right. There are actually structured and systematic approaches to ethical analysis that make sure all relevant information is considered and a principled resolution can be reached. These approaches provide guidance for both reasoning through the ethical issue and communicating with stakeholders to arrive at a solution. This is the work that clinical ethics consultants do when they are called into a case to address an ethical dilemma, and they are useful frameworks for clinicians to work through when faced with ethical issues during patient care. Structured approaches to clinical ethics provide a neutral and comprehensive framework that helps the ethicist to suspend their own position to consider other opinions and factors in the analysis in an unbiased way. There are several different approaches that rely on various ways of thinking. Some are more clinically oriented, like the 4-box method, while others take a more philosophical approach, such as the ethics workup. All of the approaches involve the same elements: information gathering, communication, and ethical analysis. These approaches to ethical analysis are just one part of the work of ethical problem solving. Along with this analysis, ethicists and clinicians often use specific communication strategies to mediate between stakeholders to reach a consensus, where possible, that is not only ethically appropriate but also accepted by the parties involved. There are times when it's important to take a more directive approach with patients and families, such as where there is a clearly superior course of action to take. But there are other times when a more collaborative approach is needed, particularly when the best option is less clear. Choosing the way we communicate can sometimes be as important as the things we say when we are trying to resolve a problem. Ethical issues are difficult questions that clinicians are confronted with in patient care on a regular basis. Why is it important to identify and address ethical issues, particularly for physicians who are already overburdened with all the responsibilities involved in patient care? First, as we have already seen, ethical issues are inevitable in medicine. Learning how to conduct ethical analysis can help clinicians work through these value conflicts rather than feel stuck or try to resolve the problem through intuition. While clinicians don't need to be fully trained ethics consultants, learning how to spot ethical issues and engage in some ethical analysis can help physicians resolve or even prevent many of the conflicts that arise, especially in institutions without more formal ethics consultation support. Learning to spot and understand the nature of ethical conflict can also help differentiate between issues that are ethical in nature and those better addressed by other specialties. For example, I recently had a patient with capacity whose sister wanted the staff to help her get a durable financial power of attorney signed while the patient was in the hospital. The staff was concerned about the possibility that the sister was taking advantage of the patient, but because the patient had capacity and the document was not related to medical treatment, the question of how far we should go to protect patients in these kind of situations was better handled by other services. In this case, risk management was called to weigh in on institutional policies and staff obligations in these kinds of situations. Identifying and addressing ethical conflict can also help to guide decision-making when there is difficulty figuring out the right thing to do, especially when there are two acceptable choices or when you think you know the right thing to do, but feel constrained from being able to do it. Oftentimes, when we think about what is ethical, we think about what is right versus what is wrong. But in medical ethics, sometimes there is not necessarily a right answer or a wrong answer. Instead, there are choices that may be better or worse. Both the uncertainty and the moral distress might be relieved by structured approaches to ethics. Rather than relying on intuition and being left with uncertainty about whether or not you made the right choice, ethics can provide a framework to walk through to lead you to the best ethical answer, or set parameters for ethical decision-making that can alleviate your moral distress. On a more personal level, learning how to identify and confront ethical issues helps physicians to develop the parameters of their own professional integrity. How will you, as a clinician, respond when asked to provide treatment you believe is unethical? These skills and strategies can provide greater awareness of ethical issues that may be impeding good care that are not readily apparent, as well as increased confidence that you are providing treatment that is not only medically appropriate, but also ethically sound. Because ethics is so embedded in patient care and ethical issues may be high-consequence conflicts, ethical problem-solving should be a routine part of patient care, not merely a rare occurrence or last-resort option. Clinical ethics consultation services, where available, are an excellent resource to provide real-time bedside ethics consultation. Consultants work with all parties to mediate conflicts, engage in ethical analysis, and provide concrete recommendations to the healthcare team on how to move forward. Involvement of clinical ethics consultants in a case is appropriate any time there is a conflict of values, preferences, and interests that affects patient care. It's important to remember that clinicians are asked to clarify values every day and use these skills of ethical problem solving perhaps without realizing it. Let me give you an example. A patient has stage 4 lung cancer, and she and her daughter have been told there may be one last round of chemotherapy that can be used, but the chances of any benefit at all are less than 20%. The attending sits down with the patient and her daughter and discusses both the option for chemo and the option for hospice care, estimating that she may have 4 to 6 months left if she declines further treatment. During the conversation, the patient says she and her daughter have been planning a trip to Europe since her diagnosis, and she'd like to take the trip before she dies. The attending explains that chemo would leave her bedridden and unable to travel, and in the context of her preferences and what she has identified as important to her in the late stages of her illness. Together, the patient, daughter, and clinician agree that hospice is the best option for her. There was no conflict, no disagreement about care in this scenario, but there was an elucidation of values and preferences of the patient, that the trip with her daughter is more important to her than the potential for longer survival, and the parties used this information to inform medical decision-making. Ethical problem solving is an integral part of patient care, and the skills and strategies of ethical analysis and communication can be used by clinicians to improve physician-patient interactions, resolve ethical dilemmas, and prevent conflicts from arising. Remember your tools. Think about how you are communicating, not just what you are saying. Identify ethical issues when they appear and watch for warning signs that an ethical problem may arise. And clarify values, goals, and preferences of the patient to help guide medical decision-making. Sometimes these tools may not be enough to resolve an issue or de-escalate a tense situation, but when that happens, ethics consultants are available in many hospitals to address ethical issues at the bedside. And don't forget, 1. Just because an ethical issue has arisen doesn't necessarily mean anyone has done anything wrong. It means there is a conflict between values that needs to be addressed. 2. Structured ethical analysis tools and frameworks exist to help you work through ethical issues and moral distress, so you are not left to resolve issues by intuition. And 3. Ethical issues are inherent in medical practice, and so ethical problem solving should be a routine part of medical care.